If you work in healthcare, you already know this. Conflict is everywhere. In the OR, in labor and delivery, in committee meetings, between physicians, nurses, administrators, and teams that are all trying to do the right thing. But here's the problem. Most of us were never trained to handle conflict well. We learned procedures, we learned diagnostics, but we didn't learn how to navigate the moment when two professionals strongly disagree. That's why I developed the SPARK framework. SPARK stands for stop, pause, ask, don't assume, reflect and respond, and create a path forward. It's a practical system designed specifically for high-stakes healthcare environments. Through keynote talks, residency workshops, and SPARK masterclasses, I teach physicians, nurses, and healthcare teams how to turn destructive conflict into productive conversations that strengthen teams and improve care. If your hospital, residency program, or medical conference is looking for a speaker on conflict, communication, and leadership in healthcare, I'd love to work with you. You can learn more in the show notes. Because in medicine, conflict is inevitable, but handled well, it can make teams stronger.
In every operating room, in every ward, in every clinic, and every team meeting, a silent battle brews. Conflict, negotiation, identity. Welcome to the Scalpel and Sword Podcast, where I, Dr. Lee Sharma, physician and conflict analyst, explore the hidden negotiations beyond modern medicine. Let's trade burnout for boundaries and learn the art of healing with precision and power.
Hello, my peaceful warriors, and welcome to the Scalpel and Sword Podcast. I am your host, Dr. Lee Sharma, physician and conflict analyst. In this podcast, we explore conflict, negotiation, and the human dynamics of modern medicine. We're going to look at a story today about the myth of the lone hero. Medicine loves the myth of the lone hero. The brilliant surgeon, the decisive attending, the physician who walks into chaos and saves the day. But the truth is much less cinematic. Modern medicine is a team sport. In the operating room, in labor and delivery, in trauma bays, in ICUs, outcomes depend not on individual brilliance, but on how well teams function together under pressure. But here's the paradox. We spend years teaching surgeons anatomy, pharmacology, surgical technique. We teach physicians all about managing patients, but we spend almost no time teaching them how to function effectively on a team. Today's episode is about why team building education must become a core part of graduate medical training and why the future of safe patient care depends on it. If you look at the structure of medical education, it still reflects a 20th century model. Individual mastery, individual evaluation, and individual responsibility. Students take exams alone. Residents are graded individually. Physicians are credentialed individually. But when you step into a hospital, nothing actually happens individually. Take a typical obstetric emergency. A fetal heart rate suddenly drops. Within minutes, you need an obstetrician, an anesthesiologist, and a CRNA, nursing, pediatrics, or neonatology, surgical techs, sometimes respiratory therapy. 5 to 8 professionals must synchronize decisions and actions in real time. And here's the uncomfortable truth. The most common cause of breakdown in these moments is not knowledge gaps. It's team dysfunction, communication failures, hierarchy problems, unclear roles, and unspoken assumptions. In other words, human dynamics. Healthcare outcomes are increasingly tied to something medicine historically undervalued: how people work together. Across healthcare safety research, one theme appears again and again. Adverse events rarely come from a single mistake. They come from a cascade of small failures in communication and teamwork. The nurse hesitates to challenge a physician. A resident assumes someone else has called the consult. An attending believes a concern has already been addressed. And suddenly, the system fails. Aviation learned this lesson decades ago. In the 1970s and 80s, multiple airline disasters were traced to cockpit hierarchy problems. Junior crew members saw danger but felt unable to speak up. The solution was revolutionary at the time: crew resource management. Airlines began formally teaching communication protocols, shared decision-making, cross-checking behaviors, psychological safety. And today, aviation pilots are trained extensively in team interaction. In medicine, we still largely expect doctors to figure it out by osmosis. Graduate medical education, which is the time of residency and fellowship, is the ideal environment to teach team dynamics. Why? Because this is where physicians truly learn how medicine works. Residents are immersed in high-pressure decisions, multidisciplinary teams, conflict between services, rapid escalation scenarios. And these are exactly the environments where team skills matter most. Yet residents only receive fragmented exposure to teamwork training. Maybe a simulation day, maybe a lecture on communication, maybe a wellness workshop, but rarely a structured curriculum that treats team performance as a core clinical skill. Imagine if we trained teamwork the same way we train skills on the wards or in the operating room. Residents would learn how to establish team roles during emergencies, how to escalate concerns across hierarchy, how to give and receive critical feedback, how to manage interpersonal conflict under pressure, and how to rebuild trust after errors. These are and should be trainable competencies. And when they're absent, the consequences ripple through the entire healthcare system. Here's a truth many organizations miss. Team building isn't about trust falls or personality tests. Real teams are forged in constructive conflict. The best medical teams are not the ones where everyone agrees. They're the ones where people can disagree productively. When a nurse can say, "Doctor, I'm worried about this patient." When a resident can question a plan. When an attending can admit uncertainty. That kind of culture doesn't happen automatically. It requires intentional training in psychological safety, structured communication, respectful challenge, rapid decision negotiation. When teams learn how to disagree well, they become dramatically more resilient, and patients benefit. So what would meaningful team education in graduate medical training look like? It could include simulation-based teamwork training, practice-based learning, not just clinical scenarios, but simulations focused on communication breakdowns and leadership transitions. Structured conflict resolution frameworks like SPARK, teaching residents practical tools to navigate disagreements between services or within teams. Interdisciplinary training, residents learning alongside nurses, pharmacists, and allied health professionals. Because real teams are multidisciplinary, not physician only. And we need to learn how to follow up and debrief after team events. Turning clinical events into learning moments about how the team functioned, not just the medical decisions made. If we build these elements into training, we create physicians who don't just lead medically, They lead human systems. The complexity of modern healthcare means one thing is inevitable. No physician succeeds alone, and no patient is saved by one person. The future of medicine depends on high-functioning teams operating under pressure, which means graduate medical education must evolve. Because if we only train doctors to wield the scalpel and never teach them how to work with the people holding the rest of the instruments, we are leaving one of the most powerful patient safety tools on the table. Teamwork isn't a soft skill. In medicine, it's a life-saving skill, and it deserves a permanent place in the curriculum. If this episode resonated with you, share it with a colleague, a resident, or a program director, because better teams make better medicine, and better medicine starts with better conversations. Peaceful warriors, thank you for joining me on the Scalpel and Sword podcast today, and until next time, be at peace.
Every episode is an invitation to speak, to negotiate, to choose. I'm Dr. Lee Sharma. Join the dialogue by subscribing to Scalpel and Sword. Until next time, peaceful warriors, may your choices be sharp and your voice be even sharper. This podcast is a reflection of lived experience and research in conflict resolution. The Scalpel and Sword is not intended as medical or legal guidance. For personal matters, please consult a qualified professional.